Good evening and welcome to the BBC's News at 6. Your chances of dying after surgery increase as the week wears on. That's the conclusion of a report in the British Medical Journal. Researchers who looked at millions of operations at NHS hospitals in England found that patients who have an operation on a Friday are more likely to die as a result of complications. But they acknowledge that the overall risk of death is still low. Here's our health correspondent Dominic Hughes on why the day of the week can make such a difference.
Concerns over death rates associated with emergency operations in hospitals at weekends are well established, but a new study shows that as the working week progresses from Monday to Friday, the risk of death following even planned surgery increases.
We know that the first 48 hours or 2 days following an operation is probably the most critical period. And we know that as patients are operated on a Thursday or on a Friday, that this period overlaps with the weekend. And we know that services at the weekend are not at the same level as they are in many hospitals offered during the week.
The study looked at more than 4 million planned operations carried out in the NHS in England over a 3-year period. The total number of deaths was actually very small, well below 1%, but the variation across the week was marked. For surgery carried out on a Monday, there were 5.5 deaths per 1,000 operations. By Thursday, that figure had risen to 7 deaths per 1,000 operations, and by Friday the number of deaths was 8.2 for every 1,000 procedures. Many of the deaths occurred after serious operations, such as lung or bowel surgery, but there is some surprise that the death rates vary so much.
I was surprised. I would like to think that every hospital that takes on surgery, big or small, has thought through the comprehensive package of care they're going to offer their patients. You know, it's a contract really. If you come to us for your surgery, we'll take good care of you. And I think part and parcel of that is making sure the surveillance in the post-operative period is absolutely top class, weekday or weekend.
This isn't something that just affects hospitals in England. International studies have shown there's an issue with post-operative care at the weekends in hospitals in Australia and the United States, for example. But while everyone agrees there is a problem, finding a solution is much more complicated.
I think it's going to be very complex unravelling this, so there may be issues of staffing, there may be issues of the way patients are looked after at the weekend, but there may also be issues of the nature of patients who are operated on at the end of the week.
NHS England is looking at how hospitals can provide more comprehensive services 7 days a week and is investigating staffing levels. Deaths after planned surgery are rare, but it's also clear that problems around quality of care over weekends are having an impact during the week as well. Dominic Hughes, BBC News.
Well, let's get more now from our health correspondent Bramwyn Jeffries. We heard there that NHS is clearly looking at this. What are their options?
Well, George, this isn't going to be a simple problem to sort out. There could be so many factors influencing what happens to patients. And we know that even within the pattern that Dominic was describing there, that if you have a very complicated operation, the risks vary even more than if you're having a very routine operation like a hip replacement. So what are they looking at? They're looking at things like how you get staffing across all of the 7 days. Now, that sounds simple, but if you're going to have enough senior doctors on duty at weekends as well as during the week, what are you going to do? Are you going to hire more doctors? It takes time to train them to the level of seniority, and it costs more to have the most experienced people in place all the time. That might mean also tough negotiations with doctors to get them to change how they work. Another way of looking at it would be to concentrate some of the most risky surgery in a smaller number of hospitals. But that would mean patients travelling further from their home for planned operations, and they don't always like that either.
All right, Bramwyn, thanks very much. Thank you. A minute's silence has been held in Woolwich to remember